This is Dr. Ashish Panchal, Professor and Head Department of Pharmacology, LJ Institute of Pharmacy. Welcome to MOOC series initiative by LJ Institute of Pharmacy. In this session, we will discuss the basic concept of inflammation. So we all know that inflammation is the first healing response. Inflammation is defined as the local response of living mammalians tissue to injury due to any agent, and there may be a infective, immunological, physical, chemical or foreign bodies. The various causes of inflammations are infective agents like bacteria, virus and their toxins. Immunological agents are cell mediated and antigen antibody reaction. Physical agent like heat, cold, radiation, mechanical trauma, etc. Chemical agents, organic and inorganic poisons, and foreign bodies like dirt, sutures, thread which are used in stitches, splinters, small wood particles. Sign of inflammations. For cardinally important sign of inflammations are as follow, like rubor means redness, tumor means swelling, calor means heat, and dolor means pain. So these are the four main signs and symptoms of the inflammation: redness, swelling, heat and the pain. Types of inflammation. There are mainly two types of inflammation. One is acute and the chronic inflammation. The acute inflammation lasting less than 2 weeks and the chronic inflammation longer duration. Acute inflammation. The inflammation is characterized by two major events. One is vascular event, it takes place inside the blood vessels, and the second one is cellular event, it takes place in the tissue. Vascular event, alteration in the microvasculature like arterioles, capillaries and venules is the earliest response to the tissue injury. This include hemodynamic changes and the changes in the vascular permeability. As the vascular permeability increase, the porosity of the blood vessels is increased. Irrespective of type of injury, immediate vascular response of a transient vasoconstriction. So first, when any kind of the injury, the small amount of epinephrine and serotonin is released, and this epinephrine and serotonin cause the transient vasoconstriction of the arterioles. Next, immediately persistent progressive vasodilation takes place. So first vasoconstriction takes place and slightly increase in blood pressure. Then immediately after the vasoconstriction, the persistent progressive vasodilation takes place, which involve mainly in the arterioles due to release of histamine. Vasodilation result in increase the blood volume in the microvascular bed of the area, which is responsible for the redness and warmth at the site of the acute inflammation. So as the vasodilation takes place, the blood volume is increased and the area become red and the warm. Progressive vasodilation in turn may elevate the blood pressure, and due to vasodilation the blood pressure may fall. This responds for the swelling at the local site of acute inflammation due to transduction of the fluid into the extracellular fluid. Slowing or stasis takes place. When the vasodilation takes place, the blood flow is decreased, which cause increase the concentration of red blood cell and thus raise the blood viscosity. Stasis or slowing is followed by leukocyte migration or a peripheral orientation of the leukocytes along the vascular endothelium. The leukocytes stick to the vascular endothelium briefly and then move and migrate through the gap between the endothelial cell into the extravascular space. This is known as the emigration. So due to the vasodilation, the WBC is migrated into the extracellular fluid. Altered vascular permeability. In acute inflammation, normally non-permeable endothelial layer of the microvasculature become leaky, and this is explained by one or more of the following mechanism. First is contraction of the endothelial cell. Most common mechanism of increase the vascular permeability. Second, mostly affect to the venules. It is mediated by the release of histamine, bradykinin and other chemical mediators. This response begins immediately after injury and it is last for 15 to 30 minutes duration only. Second phase is retraction of the endothelial cell. Structural reorganization of endothelial cell cause reversible retraction at the intercellular junction. It also found in vein mediated by interleukin 1 and TNF alpha. It onset for 4 to 6 hours after the injury and it is last for 2 to 4 hours. So it causes the delayed and the prolonged leakage. So first is contraction of the endothelial cell, second one is retraction of the endothelial cell. The third is direct injury to endothelial cell. The direct injury to endothelial cell cause the cell necrosis and appearance of the physical gap at the site of detached endothelial cell. The increased permeability may either appear immediately after injury and last for several hours or days. That's why it is known as the immediate sustained leakage, or may occur after a delayed 2 to 12 hours and last for days also. Endothelial cell injury mediated by leukocyte. Adherence of leukocyte to the endothelial at the site of inflammation cause activation of leukocytes. The activated leukocytes cause release of proteolytic enzyme and ROS. This lead to endothelial cell injury and increase the vascular leakage. And the next is leakiness in the neovascularization. Newly formed blood capillaries under the influence of VEGF means vascular endothelial growth factor during the process of repair are exclusively leaking. The next event is cellular event, and in cellular event there are again two processes. One is the exudation of leukocyte and second one is the phagocytosis. So exudation of leukocyte means the leukocyte migrated from blood vessels to injured part, and these events takes place by change in the formed element of the blood. So due to stasis or slowing the blood flow, the central stream of the blood cell widen and peripheral plasma zone become narrower because of the loss of plasma by exudation. This phenomenon is known as the margination. As a result, margination, the neutrophil come closer to the blood vessels, which is known as pavimenting. Then after rolling, means the WBC is rolled over the endothelial layer of the blood vessels and adhere to the endothelial layer of the blood vessels. This neutrophil slowly roll over the endothelial cell, which is known as rolling. It is followed by bonding between the leukocytes and the endothelial cell, known as the adhesion phase. The following molecules bring about rolling and adhesion phase. Migration. Leukocytes move along the endothelial surface till a suitable place between the endothelial cell is found. Once the space found, neutrophil lodged between the endothelial cell and the basement membrane by damaging it through the collagenous and escape into the extravascular space. This is known as the E-migration. The damaged basement membrane is repaired immediately. The neutrophil found in the inflammatory exudate in the first 24 hours, while monocyte macrophage appear in the next 24 hours. Neutrophils are short-lived, while the monocyte macrophage survive for the long period. Simultaneously, of the E-migration of the leukocyte, escape of the RBC through the gap between the endothelial cell, known as the diapedesis, takes place. This diapedesis gives the hemorrhagic appearance due to exudate. Cellular event, the next phase is the chemotaxis. Movement of leukocyte from blood to interstitial space is known as the chemotaxis. The molecule which has attracted leukocyte towards them is called the chemotactic molecule or the chemokines. The most potent chemotactic molecules are leukotyne B4, component of the complement system, cytokinins, interleukins, particularly interleukin 8 is responsible for the chemotaxis. Next event is phagocytosis. Phagocytes means the cell eating. It engulfs the foreign particle, in which the recognition and the attachment is the first step. In this, the receptor present on the phagocyte which recognize the foreign bacteria is known as the phagocytic receptor. Second phase is engulf these phagocytes. The organism bound to the receptor is ready for the engulfment. This is accompanied by formation of the wall around the particle enveloping in the phagosomes or phagocytic vacuoles. The phagosomes fuse with the lysosomes and form a bigger vacuoles known as the phagolysosomes, and then after kill that, the microorganism is being killed by the antibacterial substance or degraded by the hydrolytic enzyme present in the lysosomes. Okay, so this is all about the basic concept of inflammation, types of inflammation. Thank you. Please subscribe, like and share our channel Pharma Ignite, and please press the bell icon for the more update. Thank you. Have a good day.